from the station that's on your side. This is Channel 7 News Daybreak.
Well, October is Breast Cancer Awareness Month, and as important as it is for women to get screened, there are misconceptions about mammograms. Elizabeth Armstrong is at Baptist Higginbotham Outpatient Center with more. Elizabeth, good morning.
Hey, good morning, Allison. Yeah, we're so excited here at Channel 7. We're doing Race for the Cure on Saturday, so we're out here at the Baptist Health Breast Center. I'm here with Dr. Amanda Farrell, and we've been talking this morning. There are so many misconceptions surrounding mammograms. I know everybody has somebody in their life that's been touched by breast cancer, and there's so many ways to prevent it, but there's also so many misconceptions around, when do I get them? Do I need to get them? What do you want people to know?
Yeah, so the recommendation for screening is to start at age 40. All the studies that have been done that show improvement in survival started screening at age 40. That's when the incidence of breast cancer kind of goes up. All the controversy started in 2009 when the United States Preventative Services Task Force made the recommendation to screen only between 50 and 75 and every other year. They even said in their statement that, yeah, there are breast cancers we're going to miss in people in their 40s, but they were okay with that. They didn't think there were enough breast cancers to justify finding them. So the American College of Radiology still recommends to begin screening at age 40 for everybody. Now, if you have higher risk because of family history, you may need to begin screening earlier than that. But for most people, average risk people start at 40 once a year.
Really good information, and something we've been talking about this morning. We have some really old mammograms on the wall back here, but something you were telling me is they all look so different. Cancers can come in the forms. They can look like calcifications or some other different things that you were sort of explaining. So it's really important to kind of get in here and figure those things out.
Right, and that's why it's so hard, because breast cancer doesn't have just one look. And so we sit around in dark rooms with all the lights off. We have super high resolution monitors, 6 megapixels, to try to see these tiny signs of breast cancer.
Okay, well, we're in one of the mammogram rooms, and I know a lot of people kind of get a little intimidated by the equipment and the process. So we're going to be in here coming up at 5:30 or 6:05. We're a little behind today. We're going to be explaining how this all works to people. So be sure to stay around for Daybreak. We're going to continue with that. Allison and Chris, back to you.
Elizabeth, thank you. October is Breast Cancer Awareness Month, and as important as it is for women to get screened, there are misconceptions sometimes about mammograms. Elizabeth Armstrong is at Baptist Health Higginbotham Outpatient Center this morning. Elizabeth?
Hey, good morning, Chris. Yeah, well, we're so excited about Race for the Cure on Saturday. I know you all probably are too. It's happening this Saturday once again, and Channel 7 is going to be there all day. But this morning, we wanted to come out to the Baptist Health Breast Center to talk a little bit about how we can prevent breast cancer, and part of that is catching it early. So I'm here with Dr. Amanda Farrell, and we've been talking. A lot of people are kind of a little nervous about mammograms. It's sort of an intimidating process. So what happens when somebody comes to get one for the first time?
Yeah, so this is a mammogram machine right here, and it is intimidating. People get worried about the amount of compression that's required and the radiation that is going to be delivered to them, but the compression is very short, so we have to look at each breast in 2 different views to be able to triangulate to figure out where something is in the breast, if there is something there. And then the compression also allows us to spread out the normal breast tissue, so you're less likely to be fooled by overlapping normal breast tissue and think it's something when it's really just normal stuff. The other thing that the compression allows us to do is decrease the radiation dose. I know people worry about radiation, but the amount of radiation that you get from a mammogram is the amount of radiation that you would get living at Santa Fe, so at elevation, compared to here, living there for 3 months compared to living here. So you would never think, I'm not going to go live in Santa Fe because of the radiation. Nah, you'd live there, but it's just a little bit extra.
Okay, so this is really good information. I know a lot of people have questions about this, and I know a lot of people also have questions about how to pay for this, kind of what that costs, and we're going to be talking about that coming up at 6:35, so be sure to stay with us right here on Daybreak. Allison and Chris, back to you.
Elizabeth, thank you. October is Breast Cancer Awareness Month, and Channel 7's Elizabeth Armstrong is at Baptist Health Higginbotham Outpatient Center with ways to lower the risk of breast cancer. Elizabeth, good morning.
Hey, good morning, Chris. That's right. I'm here with Dr. Amanda Farrell. We've been talking about all the things this morning. We just went live on Facebook, so if you have any questions, go check there. But we're talking this morning. A lot of people have questions about ways to prevent breast cancer. What are some of the ways to do that?
Yeah, so a lot of your risks are sort of baked in. There's not a whole lot you can do about it. But anything that you can do for heart health is pretty much good for your breast health. So get your 2 hours of activity in per week, and that will decrease your risk for breast cancer and heart disease. The number one killer for women is heart disease. So anything you can do for that is good for your breast.
Okay, I know a lot of people have questions. We've been talking about mammograms this morning. You kind of broke down the 3D mammogram machine. A lot of people have questions about how to pay for this. What are some ways that we can do that? Because these are appointments you have to make every year.
Yeah. So a lot of insurances do cover mammography, some don't. And then there are people who just don't have insurance. So we have payment programs for people like that. The breast care program helps people who don't have insurance and who are low income. And also there are Komen grants. So there are ways to find money to pay for a mammogram even if you don't have insurance.
Okay. Well, one final question. Everybody needs to make an appointment this year, 40 and older. And if you have a risk, maybe even within your family, maybe even younger. So you can call the Baptist Health Center. How do they need to do that to schedule an appointment?
Yeah, so you can call the Baptist Health Line and they will get you to the scheduler so you can schedule your mammogram, or you can call 501-202-1922.
Well, thank you so much, Dr. Farrell, for being out here answering all our questions. Once again, on our Facebook page, we just did a Facebook Live. She broke down everything on there. So if you have any questions that didn't get answered this morning, Facebook Live on our KATV Channel 7 Facebook. Allison and Chris, back to you.
Elizabeth, thank you.